my clans are Tuaket Linin Slimpet Ani Bashishin, Kelichini Dashiche, Tachine Dashinale. So those are my 4 clans. We always do this among Diné people, so we all know how we're related and how we can express kinship among one another. I'm honored to moderate this session today. It's the 5th monthly webinar that we're holding, and we decided to do these webinars because we weren't able to come together at our national annual conferences. I am coming from Utah. I'm at the University of Utah, and this is the land of the Ute, Paiute, Shoshone-speaking people of the Great Basin. I welcome everybody who's on the call today, and thank you for joining us. So I'm just going to go through a few things, our protocol. So all participants will be muted, so please do mute your phones, computers, microphones that you have. There'll be a Q&A session following each presentation, and please do type into the chat box any questions that you have, or you may email your questions for Maggie Grandin at mgrandon@aihec.org. She's with AHEC. There will be a brief evaluation questions that pop up following each presentation, and we'd like you to complete those. The webinar is being recorded and will be made available on the NNHRT website. NNHRT stands for National Native Health Research Training, and this is the 3rd year that 3 organizations have come together to provide research training: Indian Health Service, American Indian Health Higher Education Consortium, and Native Research Network. The next webinar will take place Wednesday, November 18th from 2 to 4 p.m. Eastern Time. And we're also adding 2 additional webinars that will be an hour each on December 9th and January 13th. We hope you will join us. So anyway, welcome. I think you have the agenda. So what we'll do just very briefly is we start with an opening prayer that will be provided by Frank Morgan. That will be followed by a keynote address by Dr. Yvette Roubideaux. And then Dr. Dan Calac from California will talk about the California NARCH that he's working on. And then finally, we will have a panel talking about traditional indigenous medicine and research. And those panelists are Babette Galang from who is Native Hawaiian, Dr. John Molina, who's Yaqui from Guadalupe, Arizona, and Mariddie Craig who's White Mountain Apache from Arizona. Okay, so let's get started. And I would like to just very briefly introduce Frank Morgan, who, and all these bios are on the NNHRT website if you want to read some more, but I'll do this very briefly. Frank Morgan is of the Sauk clan, born for the yucca fruit people. His maternal grandfathers are Ledge of Mountain clan. Paternal grandfathers are Mini Goats clan. He grew up in the Four Corners area on a farm in Sheep Branch in a place called Gadi'ai. He's raised in the traditional way of Navajo life. Frank started off getting educated as a psychologist, and over time he started working in ethnographic research, and where he realized that his knowledge of Navajo culture and language was his primary means to doing his work. Frank is a translator, interpreter, curriculum writer, health educator, and organizational trainer. I know that he has translated a lot of work, research that's been going on out there in Navajo, and he also developed medical terminology for diabetes and cancer, so that's very useful for people to understand what we mean when we say diabetes or cancer. Frank believes that everyone should know how to speak, read, and write his or her traditional language. And finally, he says, through the knowing of one's traditional language can personal identity, strength, and stability be instilled. So Frank will offer our opening blessing. Thank you for joining us, Frank. Yeah,
Zed. I'm going to introduce myself to the natural world where the holy people are, and I'm going to be repeating things, so just want to let you know that I'm not stuttering. So here's our prayer, to bless our meeting and our discussions. Yorkaisan biyajinshle, Yorkaisan biyajinshle, Yorkaisan biyajinshle, Yorkaisan biyajinshle. Hajine yidel nada tsalke nshlingo dishne. Hajine yidel nada chike nshlingo dishne. Be edelkele nshlingo dishne. Be edotlije nshlingo dishne. Sha yinis zine nshlingo dishne. Jona eshe trago dishne. Kote hojon dolek na hosan shama yadelkele tra. Diche ko ebenige holongo nal kide be etlasidlin. Na we dan ni lingo, ni yazda ni lingo, kwe a hikre. Na al kha, et hi, a kit eat hi, but kha hat ego, na ke yedel titole. Ni ke huint edo, saden joni be, ni hui la dole kodo. Na ye lastlai, ye hotadolt hi, be betahotit hi. Which is not at all daily doing it's it all lately, not a caco, ain't a big yatel tito. This na ye he can't me or he did so. As shown the adult echo be hardy cut as shown the. It has ade, me head a wheat either, me hit in there. And has ahto ihotit atat which that are not needle as shown the Nahatchen don hit it's loud cut and dark cree do benailt ohi than lingo and dark hedole. Nigan sekes that it's zilgo sad bohuna zani atatil nil nils such Nahaliado. Natchen, Dotan hike, an hital hojon, nasi catole. Deepe, then hitching hojon dole. The hot digging there, digging the net, the hot long then hitching hojon dole. Ada yon hit on need dole, hit is sant dole. Adoleyat ehitan ho sant dole, ada hojona hastly. Hojona hastli.
Yeah, Frank. Okay, so moving right along. Thank you very much, Frank, for that beautiful traditional blessing. So we have our keynote speaker, Dr. Yvette Roubideaux, who has an MD, MPH. She's currently Vice President for Research and Director of the Policy Research Center at NCAI. Yvette is Rosebud in Standing Rock, Lakota. She has done so many wonderful things. Among these are serving in the Obama administration as Senior Advisor to the Health and Human Services Secretary for American Indian Alaska Natives and Director of the Indian Health Service. And she's currently adjunct professor at Colorado School of Public Health. She's been at the University of Arizona and Washington State University. She has done a lot of work with diabetes and cardiovascular disease and research. She is one of the founding members of the Native Research Network. and we go way back to the late 1990s to form that organization. She's also been president of AAIP, the Association of American Indian Physicians, and she's co-edited a book. I think many of you have read that or perhaps tend to read it. So I'm really proud and honored to introduce our keynote speaker, Dr. Yvette Roubideaux. I have known her for many years, and I'm really happy that she is joining us today. Yvette?
Great. Well, thank you so much, and I appreciate the invitation. I'm really grateful to have the opportunity to join you all today. I'm going to share my screen. Cross your fingers. All right, I think it worked. Great.
Yeah.
Well, again, it's a pleasure to be here on this webinar. I'm so grateful for the invitation and grateful for the opportunity to speak with you today. It's great to see old friends from going way back. I see many of you on the screen, and thank you for joining today. I'm pleased to give an update on what the NCAI Policy Research Center has been up to in the last year or so. And I think when I was doing my job primarily as a researcher, I'm not quite sure I understood what NCAI was. It's the National Congress of American Indians. It's the oldest, largest, and most representative national organization that serves the broad interests of American Indian and Alaska Native tribal nations and primarily works to advance tribal sovereignty. And the great thing about being able to work at NCAI is it's a place where a researcher can work on policy research that's directly influencing policy and advocacy at the national level. So I just feel like I'm very lucky to be able to be the director of the Policy Research Center at NCAI. I was asked to provide an update on our work at NCAI at the Policy Research Center. We have been so busy, as I'm sure many of you have been. This year has sort of been a blur, given all of the things that are happening with tribal nations and COVID-19 and the economic issues and all of our legislative and administrative efforts to try to get tribal nations the resources that they need. But fortunately, at NCAI, everybody knows the value of data in informing policy, and we've been in the thick of it trying to help the organization and tribal nations to get the data that they need. And that's really the mission of the NCAI Policy Research Center, is to try to help tribal leaders get the best available knowledge, research, and data that they need to make strategically and proactive policy decisions. And so I also like that it's in the framework of Native wisdom. But it's so important that tribal nations have data and research for governance. All right. I wanted to show you a picture of our team. It's me on the right. In the middle is Gwen Evans-Lomayezva. She is a researcher with the NCAI Policy Research Center and really helps a lot on some of our really complicated topics. And then we also have Sierra Watt. She's a research associate. She was just one of our Wilma Mankiller Fellows last year. We're grateful that she stayed on to work with us. And we have a great team there, and we're the data nerds at NCAI. We're the ones that are really excited to talk about data while everybody else is talking about policy, but it all fits together in the end. And so the mission really is for us to try to help tribes get the data that they need to make strategic and proactive policy decisions. So we have a new Chief Executive Officer who's great, and he's been helping us envision how NCAI can further help advance tribal sovereignty. And what he's done is had us think about our value propositions. This is a businessy way to say, how do we make sure that we're serving our primary customers, which are the member tribes of NCAI and NCAI members. So for the NCAI Policy Research Center, We have three main areas. The first is research, trying to provide research and data for tribal nations on their priority issues. The thing about this is it's not Yvette Roubideaux's portfolio of work. This is research and data that the tribes want and need to help them with policy. The second area is strategy, helping tribal nations use data in a strategic and forward-facing manner so that they can plan for the generations to come. The third area is sovereignty, enabling tribal nations to exert more effective sovereignty over data and research. And this is probably my favorite area, trying to advocate for tribes, their sovereignty, and tribal governance and research, which I'll talk about in a minute. So the first area is research. We don't do a lot of primary research. A lot of our research is helping synthesize results for tribal leaders in a usable format so that they can use it for decision making. So, for example, this year we've been very busy with trying to get data to the tribal nations on COVID-19 cases, deaths, and so on. And so we're looking at publicly available data sources, and we do weekly situation summaries for the tribal nations overall and then for the NCAI regions. In addition, with the 2020 census and all the get out the count efforts, since July, we're publishing self-response rate by downloading data from the U.S. Census Bureau weekly and then sort of analyzing it in a way that makes sense to tribal nations. So the graph in the middle is looking at, in the green bars, the 2010 self-response rates and then the progress of each of the NCAI regions. We're also currently working on 2020 Native Vote data reports, which involves, for example, looking at the American Indian Alaska Native voting age population in each state and then comparing that to the polling margins for certain key races. And that little graph that you can see with the blue and red bars, for example, in the Arizona Senate, the American Indian Alaska Native voting age population, according to the 2009 ACS, is 5.6% of the population, and the voting margin is only 4%. So if we had really great turnout of the American Indian Alaska Native voters, they potentially could influence the race. COVID-19 has been such a big thing for Indian country. The impact, as you all know, has been significant on all of our lives and the lives of our families and our communities. I think you all know that according to the Indian Health Service, since March, the cases have risen to over 60,000 cases. CDC shows the deaths over 2,000 and probably even more than that if you include other diagnostic categories. The impact varies, of course, by region. It's frustrating that there's been a lack of data for American Indians and Alaska Natives. A lot of us may understand that a lot of the data we're seeing are underestimates of the true impact, but we're still tracking the trends nonetheless. We have to use the data that we have, but we are advocating for better data. The toll in our communities has been significant, as you know, economic, physical, mental health. Access to care is an issue, supplies and tests are still an issue, and now we're hearing about issues around access to therapies and the vaccine trials and those kinds of things. So it's a big topic. We spend a lot of time at NCAI trying to meet tribal needs on that. We do have a NCAI COVID-19 resource website. That's the link there. It has trusted resources for you to look at. We publish our reports there. And our policy team publishes legislative and administrative resources and letters and summaries of bills and things like that. So if you like policy, research, policy, that's a great website to go to. I also included a graphic that our great graphics person, Ken Rick, developed on trying to encourage people to be safe during COVID by staying in place and maintaining your space and covering your space. I think you've all seen this. It's a little fuzzy, but you know, the data does show that American Indians and Alaska Natives have higher cases,
Hey,
higher
Steve, don't you have a Zoom call?
and higher deaths. Okay.
It's 2:27.
You might want to mute. All right, thank you. The American Indians and Alaska Natives have higher cases, higher hospitalizations, and higher deaths from COVID-19. I think we all know that, but it's good that at least we're seeing some data that confirms that there's definitely a need for more data in this area. Some other things we've worked on in our research portfolio is we've just published a review of data and literature on services for American Indian Alaska Native victims of crime. We had a webinar featuring the tribal epidemiology centers and their important role in the COVID-19 response. And last year, I want to make sure you knew about, we published a report entitled Becoming Visible. It's a landscape analysis of state efforts to provide Native American education for all, and it's really helped catalyze additional efforts to try to make sure that there is appropriate and accurate education in K-12 schools. The second area is strategy. That's where we help tribes use data in a strategic manner. And that's really a lot about our annual Tribal Leaders Scholar Forum. This year we had to hold it virtually. It was a great 3 half days of presentations and discussion about research and data. We're hoping to make those presentations available soon for both the people who attended to access, but also others as well. So we're working on that, hope to have it soon. During the 15th Annual Tribal Leaders Scholar Forum, we use Zoom like this, so there's a picture on the bottom left of our poster session where we actually continued to have the poster sessions virtually. And then on the right, we had a think tank discussion on supporting the next generation of American Indian Alaska Native researchers, and we used the technology called Padlet, and we were able to have the audience actually type in their recommendations under various categories. So that was a really invigorating and really great conversation. All the usual things came up, and it'll help inform some of our efforts at NCAI, so we're excited for that. The third area is sovereignty, helping promote tribal sovereignty over research and data and tribal governance of research and data. Some of you may have attended our Holding Space trainings. This is our project on a guide for partners in tribal research. We, through our NARCH funding in the past in 2 prior cycles, we funded the development of a discussion guide and the Tribal Research Future Game, which is an interactive scenario-based way to actually role play some of the difficult decisions tribal and academic researchers have to face as they partner on research. Unfortunately, our trainings are on hold due to the COVID-19 pandemic, but we are hoping to do some work in the future on creating an online version of this training. You may notice that the foundations that we believe are important for tribal academic partnerships, governance, culture, and trust are part of the theme for this whole webinar series, and we're honored that the group chose to highlight those concepts. So thank you so much for that. And then the last thing we did before COVID hit was a training in University of Minnesota. So that's our last in-person training on this until the pandemic hit. We also spend a lot of time on policy related to research and data, responding to tribal consultations, commenting on federal agency research and data issues. We've done a lot with NIH in the past couple of years. Many of you know that the All of Us research program got off to a bit of a rocky start in terms of tribal consultation, but recently they sent out a consultation and a report of all the things they're planning to do to try to honor tribal sovereignty and governance over data and research. So progress is being made. I hope that we'll see some good comments to that consultation. They have held consultations on the data sharing policy, intellectual property rights. They recently consulted on COVID-19 research, and they're working on the tribal consultation policy. I serve as a technical advisor on the NIH TAC and welcome any input you may have for us on that. The U.S. Census Bureau, we spent a lot of time on that recently. Unfortunately, the census ended early, but we, at NCAI, we have a whole civic engagement team that has been working in that area. For the Policy Research Center, we've been working on trying to provide advice and get more information about the disclosure avoidance system that will help protect the privacy of the census data. But unfortunately, their new application of a statistical method called differential privacy is going to potentially result in the unavailability of some prior data reports that we used to get on the census for American Indians and Alaska Natives. and also is making the tribal data be so inaccurate to the point that some tribes are having negative numbers or even zero numbers and disappearing from the data. And so it's a really serious issue that's now starting to become more important. And so there is a tribal consultation scheduled in November, on November 17th. We're going to talk about it at our annual meeting. We've written a number of research policy briefs, have some webinars and some letters on it. I encourage all of you to learn about this issue of how they're protecting privacy now with the census, because, you know, it's like a storm of all these different things that may lead to the census not being usable for us. The response rates were low because the enumeration was cut off early. We had the COVID pandemic that led to lower response rates in general, and a delay in the non-response follow-up operations, the update leave and the enumeration. And then the processing period between now and when they have to get the products out is shortened, and so that's going to make it inaccurate. And once they apply the privacy protections, that's going to make it even more inaccurate. So this is, I hope everybody who loves research and data and knows how important census data is, please learn more about this issue. I want to just illustrate it really quickly. So the census data is all collected, and then what happens is you have the raw data file. Then there's a census unedited file that's used for the apportionment counts to determine the Senate representation, or House of Representatives representation for each state. Then they edit the file to make it more accurate, and then that's when they apply the disclosure avoidance system to make it more private, which includes a lot of different complicated pieces. Then they get the detailed microdata file, which they use for the Group 1 data products, which includes the redistricting file and the demographic and housing files. So all of these steps right now are compromised. The data coming in, the processing in the red, the privacy system in the purple, and then getting to the products that are done. And we still don't know what's going to happen to the Group 2 products, which includes the American Alaskan Native summary file, which a lot of people use in their research. So again, I encourage you to learn about this topic. It's really important. We have a guide to the 2020 Census Data Privacy webinar on our website and under events and webinars, where we had some data experts in this area come and present some of the graphs that show you what happened to the tribal data. And we just heard that the current version of the demonstration data they just released has a huge error in it. So now we have no idea what the impact is on tribal nations. So hopefully we'll get better data in November to look at. The really important part. As I start to wrap up, I want to talk about how we've had to move our NCAI Policy Research Center exhibit to virtual. So during the Tribal Leaders Scholar Forum, Gwen Evans-Lomayezwa, our researcher with our team, created a background that made it look like she was standing in front of the exhibit. And we did a Zoom session for the attendees to come and learn about the different products and briefs and things that we have to offer. So we'll be doing this at our NCAI annual conference as well. And by the way, I would be remiss to not invite you to the 77th annual NCAI Convention and Marketplace. The title is Truth and Reconciliation, and it's happening November 8th through 13th. And if you'd like to attend, you can register at our website. The conference will be a little different this year. There will be some general assemblies and breakouts, but it's mostly focused on the Congress function of NCAI. So NCAI is basically meant to be a national Congress for tribal nations. And so representatives register as delegates, and then, resolutions are considered and voted on, and those are considered to be the priorities of the organization. And so it's intended to be like the U.S. Congress, only it's a Congress for tribal nations. If you've never seen that, I encourage you to come to our virtual event and see how we're adapting that, and the voting on resolutions and discussions on policy issues. It's really, really quite interesting, and I learned a lot about it as IHS director, and then working at NCAI, I've learned how important this process is to achieve tribal consensus on policy issues, so that when we advocate as one voice to the federal government and to Congress. Finally, this is my contact information, and you're welcome to contact me if you have any questions. I think this presentation will be made available on the website, and we have our website. I encourage you to go to our publications page, our research recommendations page, and our events page for our webinars. Those are some of the most important resources that we have. And follow us on Twitter. We do try to keep up with that. I'm, the younger generations at NCAI have to help me with that, but we're doing the best we can and trying to get the information out there that can help you understand research and policy and how it relates to tribal sovereignty. That's all I had today, and happy to take questions.
All right, so thank you for that presentation. I wanted to ask you, we have 2 questions. And again, if anyone has any additional questions, please submit them in the chat box, or you can email them to me, maggie.grandin@ahec.org, and we'll get them passed along. My first question is, other than educating ourselves on the U.S. Census Bureau and privacy concerns, etc., do you have suggestions for any action items that can be taken within our communities or organizations?
Yes, thank you for asking that question. That's really important right now. So as the U.S. Census Bureau is starting to finalize decisions on how they're going to apply the privacy protections, the way differential privacy works is that you have basically what's called an epsilon, which calculates the amount of the privacy budget that they use to protect the data that they want to be accurate versus not. So, for example, they're saying they may apply more of the privacy loss budget to American Indian Alaska Native data, which would be great, but they're talking about data on tribal lands and geographies. So the challenge is, where do they apply the accuracy in the whole Census Bureau budget, but still protect privacy? So the one thing that you can do is think about how you use census data, and think about how your tribe uses census data, and how that might negatively impact what you do or what your tribe does if that data is not accurate. Now, we know that the data hasn't necessarily been accurate in the past. In 2010, they had privacy protections where they sort of swapped out data at the block level, but it wasn't that bad. But right now, what they're proposing to apply could, severely affect the accuracy of census data, especially for small, rural, and remote tribal nations and communities. It's not just us. There's other communities in the country that are being impacted also. So what the Census Bureau needs to understand and needs to hear from you about is how you use data and why it's important to be accurate at that level. And they think about data in terms of the geographic levels. And there's a geographic spine that's used for American Indian Alaska Native data, and that's not actually on the actual geographic spine that the Census Bureau uses now. And so it may be that the data will be accurate at the state level, but it might not be accurate at the census tract level. It definitely may not be accurate at the block level. And we know that census tract data and block level data are really important for tribal nations and really important for tribal communities. So I would encourage you to have those conversations in your community about how people are using data, and make sure that the U.S. Census Bureau hears what those uses are and how important they are. So make sure your tribal leaders attend the consultation on November 17th, and feed them all the information you can to help them with their recommendations. Although there are a few tribal leaders who are PhDs and really smart on this topic, so that's great to know. But just think about that, and think about what it would be like if we did not have accurate data for American Indians and Alaska Natives in this census. There's also people working on trying to encourage Congress to extend the statutory deadlines for the apportionment and the redistricting file. I can't tell you to advocate. I'm just informing you about that today. And there's also people talking about how normally the Census Bureau would have 5 months to process the data after the enumeration ends, and now they only have 2.5 months. And Census Bureau statisticians have been leaking information, I think, to let people know that they don't have enough time to do everything that they normally would to ensure that there's no duplicates, that the data is accurate. And when they don't get the data for self-response, they end up using administrative data. And we know administrative data is not great for American Indians and Alaska Natives because it doesn't have the race, or it doesn't have, American Indian Alaska Native associated a lot of times with the record. So there's a lot you can do to learn about the issue and a lot you can do to help tribal nations understand this complicated issue and report what your use cases are. It's called use cases. What are the uses you need the census data for and why that's important?
Great, thank you. And then just one more question. What is the NCAI liaison with county, state, national levels? And could you talk more about the affiliations with other organizations like the APHA, AAP, AMA, CDC, etc.?
Yes, NCAI does partner with a lot of different organizations on its advocacy efforts, and it's a lot of times through our networks of working with other civil rights organizations on issues that affect other groups more broadly. We try to sort of realize that NCAI has one voice, but there's all these other people out there advocating for similar things. So if we're all speaking in one voice, we're all advocating together, that helps a lot. Even on these census data privacy and accuracy issues, we're working with organizations all over the country on it and trying to connect with them. We do connect with organizations that cover state and local things, but NCAI tends to work on issues at the national level, and we encourage our tribal members to engage on the state and the local level as well. But NCAI is sort of everywhere, and I guess I wasn't surprised, but NCAI is a very busy place to work. There's lots of people wanting our time and wanting us to work on various different things, and we do our best to keep focused on tribal nation priorities. But we do have those connections, and if any of you think we aren't connected where we should be, you can feel free to email me and I can pass it on to whoever in our organization needs to know those things. But yeah, I do know, especially when we're trying to get things passed through Congress, we're working with a wide variety of organizations.
Wonderful. Thank you again so much for that presentation and for those questions. Again, if anyone else has any questions throughout this webinar or afterwards, you can put them in the chat box, send them to me, and we'll make sure we get them passed along. Before we move on and I switch it back over to Lillian, I wanted to have everyone, after each presentation block, we're going to have a poll on that presentation. So I'm going to pull up a poll on your screen right now, and we're just going to take a minute or two to complete that. So if you could go through that really quick, and we'll leave it up for about 60 seconds, and then we'll keep moving right along. And we do appreciate your participation here. And we'll give it about another 30 seconds. So if you haven't participated in the poll yet, please go ahead and do so. All right, and we'll go ahead and end that poll. And Lillian, I will hand it back to you. Thanks so much.
Okay, thank you very much, Yvette. That was just wonderful information, lots of resources. Okay, our next speaker is Dr. Dan Calac, who is Chief Medical Officer for the Indian Healthcare or Council, Principal Investigator of California NARCH. We were so looking forward to Dr. Calac being with us just down the street from where he lives, because that's where we're going to have our annual conference north of San Diego, but that wasn't to be. So this is the next best thing. I feel like I know Dan very well just through all of these emails and so forth, and trying to get him on, and he was very willing to do it. And just from what I learned about him, he is constantly juggling, doing this juggling act, being a direct provider in the clinic he runs. He's the PI for the California NARCH, working with various institutions, with tribes throughout California, and involved in capacity building, strengthening relationships with academic partners to promote studies within the high-risk populations that he serves. They're addressing health disparities using methods that are community-based to reduce disparities and increase health literacy. I know that California has one of the largest American Indian Alaska Native populations, and many people don't know that. And Dr. Felicia Hodge is always reminding us of that. So hopefully through this presentation, we'll learn a little bit more about California Native people and the work that Dr. Calac is doing through the California NARCH program. Thank you, Dan, for taking time from your busy schedule to be with us, and we look forward to sharing all this wonderful information about California NARCH.
Thank you very much, Lillian, and I hope that screen is up for you. I see it there, and it's a wonderful opportunity to speak. I see a lot of great friends, and Dr. Roubideaux, of course, great presentation. Thank you very much. It's so wonderful sharing some time with you virtually, if anything. And my name is Dan Calac. Hello, how are you all doing? I'm a member of the Pomo Band Luiseño Indians, and it's a wonderful opportunity to be here all with you, with my colleagues and some friends from across the United States on the East Coast, as well as some former mentees as well. So it's wonderful to actually share this time with you. I really could go on for almost 2 hours, if not 4, on the wonderful opportunities here in California, especially as it pertains to NARCH and the community-based participatory research that we're producing here in California. And Lillian really hit the nail on the head in terms of the diversity that we enjoy here in California. There's over 110 different tribal, distinct, federally recognized tribal entities here in California. And so, creating some type of program that's applicable to all those different individuals, those distinct dialects, those distinct cultures, is daunting at the very least. And most of those American Indian tribes, at least 30 tribes or so, are south of Los Angeles, and it is one of the highest concentrations of American Indians across the United States, along with per capita, that is, along with the Southwest and of course Oklahoma. So I'm going to delve into the presentation here moving forward. If I could advance my slide, there we go. So we're just going to talk briefly on some learning agenda items, just a brief description of health disparity across an Indian country, looking at healthcare data, and I'm so glad that Dr. Roubideaux is here because she is one of my mentors moving forward, so I'm glad to acknowledge her in my presentation. Looking at some workforce challenges and how that really translates to research and the need for research within our communities across the United States, and looking at potential avenues for engagement and as it manifests itself in the NARCH mechanism. So health disparity is so commonplace in the American Indian population. And many of us, as we come into our 30s and 40s, and for example, myself in my 50s, are becoming much more aware of it and recognizing the time that we have left and to do the most important work that we have on our plates. And so when that is compromised and because of health disparity, because of disease processes that take its toll in all demographics, and it's been even more evident in this era of the pandemic, the life expectancies of up to 5, even 10 years, depending on where you are across the United States, for men and American Indian men and women and children is astounding, and especially some of the more impoverished areas in the Southwest, in the Upper South, or in the Upper Midwest, and of course the Southwest, and all throughout the United States, is really something to delve into, and as eye-opening in terms of what challenges American Indian and Alaskan Native individuals are facing. And those challenges are broad, and they run the gamut in terms of economic, social, geographic, criminal challenges that are throughout organizations. And these 9 CDC listed public health strategies pertain to 99% of the communities that are across the United States. And a wonderful opportunity that I've had in serving with the American Academy of Pediatrics on the Committee of Native American Child Health, I was given the opportunity to visit a lot of these tribal entities and health clinics across the United States. And as many people in the audience will know, these 9 strategies definitely apply to many of those areas across the United States. Whether it be health literacy issues and just dosing Tylenol for your infant, or just knowing what medications you're taking, or accessing the need for cancer treatment, looking at community engagement, or even transportation. The ability for our communities to travel to their appointments or to access subspecialists in other states, and getting there after a 4-hour drive or a 1-hour drive, or even a 20-minute walk when there's no sidewalks and the roads are fairly treacherous with no margins, can be a very, very daunting task for many of our clients that we serve across the United States. And so this is the Roubideaux slide, and so and she's probably smiling right now. I don't have her up on the screen, but I know I always use this slide, and I now that she's with NCAI, I should probably look at some of the updated information. But the information that we have, supporting American Indian Alaskan Native research, and this is one of the reasons why NNHRT is so important in terms of developing and promoting research and spreading the word about the research that's going on, is that there's not a lot of research out there. And accessing the research in communities that is appropriate, that is culturally sensitive, that is helpful to these communities is so important, but it's so sparse. Recognizing that there's so many healthcare gaps in communities, like Alaska or the Southwest, or even some of the issues regarding the public health strategies that we just spoke about, the ability to provide that healthcare is something I've really struggled with over the past 17 years as the Chief Medical Officer here at Indian Health Council. And when I retire in 10 to 15 years, it's that question that I'll be asking myself: did I really make a difference? And of course, we all are asking that questions, through our careers. But in the monumental task in addressing some of these healthcare issues and the data that we need to support to make informed decisions, that is where the community-based participatory research and NARCH mechanisms and the research that we're discussing now is so important. So that definitely translates to the workforce and how we provide that care throughout the United States and outside areas. And so we need clinicians as well as researchers. We need individuals who have, of course, bachelor's and advanced degrees, master's degrees in public policy and public health, and we need individuals who have PhDs, as well as people who have MDs. And so when we see data like this, when we see information from the American Association of American Medical Colleges recognizing that there's been a tremendous decrease in the amount of applicants over the preceding 2 years compared to previous decades, that is very scary. And it really, it's an awakening to all of us, recognizing like, what can I do to really improve this process for our communities, recognizing that there's already going to be a healthcare shortage across the United States, and every now and then, every 1 or 2 years, there's documented or there's news stories about RN shortages or physician shortages. But this is much more of an important topic when it comes to Indian country, and having providers who are from the communities that they serve go back and serve those communities from whence they're from. This is another graphical representation of that. And so of the 93,000 medical school graduates in between 2012 and 2017, according to the AAMC data that came out about 2 years ago, only 131 were self-identified as American Indian and Alaskan Native. And so spreading those 131 individuals across the United States to serve the over 3 million people that need those positions, and ask them to do culturally appropriate and sensitive community-based participatory research, and have that life and work balance so they maintain happy and productive lives, and go ahead and have proteges and support their process when they're in communities, is obviously not feasible, given what we're looking at. And so recognizing this, what can we do to address it? And so it seems fairly straightforward in terms of what we could do to address more scientists, more clinicians, more participation in our communities to address some of those healthcare strategies and shortages that we just spoke about a few slides back. Better understanding of the health community issues where that research comes in, advocating for tribes, as Dr. Roubideaux mentioned, in terms of promoting their rights to sovereignty and educating them about resources that they can access, getting more effective treatments, and then overall improved health. So it seems pretty straightforward in terms of what we need to do, but how would we go about getting that process moving forward? And that's where NARCH really kind of comes in. So NARCH has been around for almost a little over 20 years, actually. And we have actually in the audience a couple individuals who are supporters of NARCH through NIH, NIDA, and NIAAA, who are great partners in supporting the NARCH mechanism, in addition to these individuals at the National Institutes of General Medical Sciences within NIH. So what is NARCH? So NARCH focuses on three primary tenets: to develop this group of scientists and or researchers, American Indian scientists, Alaskan Native scientists, health professionals, to sending them off to school and then getting them to come back to the communities, because we know that if they're from those communities, they're going to more than likely come back to serve those communities in some capacity or another. Also addressing the relationships that we have with our academic partners, really reaching out and promoting and helping tribal entities with that sovereignty component, and increasing the capacity, the collaboration they have with our colleagues. And then lastly, to facilitate research, to address those issues moving forward. So there's been a lot of research projects that we've had here within the California NARCH, and this is just a short list of some of those research projects that we've addressed here in California. We're going to talk about a couple of them moving forward, and then we'll wrap up with some some comments about what we can do next. So first and foremost is the California Student Research, a student development program. And so this addresses the need for researchers and clinical individuals to provide that care within American Indian country and Alaskan Native areas. And this is the morass of acronyms that they have to navigate in order to kind of get to that part where they're providing care. And so these, of course, this is the obstacles that come up for high school students, for our junior college students, for our gap year students, those individuals who have completed a degree but then go to work and find they're disenfranchised from the career that they chose and want to go back and finish a different degree. But having people navigate this process is very difficult, even for those who are well supported. And the ability to provide that support with our student development team. Several people are on the phone call now, actually, who can speak to this, is a critical part in providing the support that they need to get out on the other side, to start engaging the community and providing that care and research moving forward. Some of the challenges that they face are many of the challenges we've actually had and encountered over the years of our own careers. Taking too many classes, of course, too many extracurricular activities, really maintaining that balance that is so critical in those intense learning environments. Of course, family ties, expectations, and needs when you're off-site and away from those who you love. The financial support, of course, is always something that people wrestle with, and of course the stressors. You know, pandemics. That's no stress, right? And so dealing with the ongoing stressors, whether they're related to school, whether they're related to social or geographic issues, there are numerous in this high-risk population. So let's talk about a couple of programs that we've allowed students to engage in and provide research. So the part of, in terms of developing that cadre of American Indian Alaska Native students, we need to get them the research in order to have them engaged, and so they can continue with that process. So the tribal NOFAS, California was one of the first California NARCHs to develop a National Organization of Fetal Alcohol Syndrome Center. And so that's really kind of astounding that we didn't have another NOFAS in different tribal communities across the United States prior to that, you know, given the relative risk for substance use disorders across the United States. But the fact that it was here in California that we developed the first one speaks to the NARCH mechanism and the success in making these programs move forward in addressing some of these issues. And of course, what does NOFAS do? For those people who are not really aware of what NOFAS does, it forms a really critical component of support for not only parents, but also professionals to understand more about what fetal alcohol spectrum disorder does and how it affects our communities and how we can learn to prevent it. Learning to prevent it is just as important as knowing about it. And so, in another component of the NARCH mechanism, we've addressed the underage drinking among Southern California American Indians. And so, why is this so important? And we know this is an ongoing issue, not only in our adult populations, but also in our adolescent populations. And so, we know that based on research done by Cindy Ehlers and her group, looking at the first episode of Intoxication. So this is a graph with the percentage risk of alcohol dependence, and on the Y, and then the X-axis, the relative age groups. And we can see that as we get near the second decade of life, the risk for the U.S. population as compared to Southwest California Indians reaches a relative equality in terms of the risk for developing independence or dependence on alcohol further on in life. Whereas if you have your first alcohol intoxication prior to the age of 20, you can see the relative risk is much increased for alcohol dependence moving forward in this study. So the importance of addressing that in our underage American Indian population is an important part in making sure they have the support mechanisms to continue in their academic programs, as well as reduce the health disparities that we see resulting from alcohol use at an earlier age. So it's not only alcohol that we have to issue, and some of the other NARCH programs looking at the risk of opioid use within the communities is something that it hasn't really been passé. You know, there was a big push in awareness about 5 to 6 years ago about opioid issue, and it's still obviously a huge issue moving forward. And this has been magnified by the recent demise of several people across Southern California, and I say several meaning, you know, in the mid-10s or 20s of fentanyl overdoses. And just even today on the news, they spoke about the increased amount of methamphetamine and illegal drugs coming across the border because of the COVID pandemic and the reduced consumption and the need to drive more drugs across the border for those drug dealers here in Southern California. So this is definitely not going away. And part of that cache of drugs included fentanyl within that seizure by the DEA. So addressing that issue of opioid presence within the community is something that we addressed about 2.5 years ago, 3 years ago with the Pill Take Back project. And this project looked at really assessing the perceptions within the community of opioids. And so, you know, what is for example, what is the perception of someone who's 50 and over or 60 and over about Norco? Do they have ever taken Norco? Have they ever taken Percocet? Do they even know what Percocet, really is? Versus someone who's in their 20s and what their perception of Norco is? It something relatable or equal to like Tylenol or Motrin? And so really assessing the community's perceptions of opioid, the consumptions of opioids, and most importantly, the storage of opioids. And so what this project also did is promoted a pill take back forum to allow people to bring in those prescriptions from those medicine cabinets, from those purses, from those areas of high risk of consumption from people who wanted to abuse them, and get them out of the community to sheriff department drop-off areas. And the culmination of this project was the development of one of the first drop-off medication drop-off areas within a Indian Health Service facility, which is in our pharmacy right now. And why is that important? Because of our previous experience, as mentioned, with alcohol and the combination and the use of opioids within the community has been shown to magnify the relative risk for emergency department visits. And so once someone is so debilitated by the use of alcohol and or opioids, which we know is a deadly combination, the risk of having something deleterious happen and loss of life in those preventive accidents is magnified many times over. And so keeping the community safe and addressing some of those healthcare strategies and making sure that they stay safe at home, where they're more than likely using, is a critical part to the NARCH program and reducing those health disparities. And so lastly, these last couple of slides really pertain to the use of cannabis. And so this is actually something that came out of NIDA and NIH, National Institute of Drug Abuse, with the ABCD study. And so the exposure and actually I should say the use of cannabis across the United States has really exploded for a variety of reasons, and whether it be a social movement, of course, the legalization of cannabis across the United States, and the use of cannabis, especially in individuals who use the medication for nausea and women of childbearing age. And so this is a takeoff, one of the arms of the ABCD study, looking at the use of cannabis exposure and the developing brain. And this is a study that looked at those exposures and then basically looking at the neuroanatomy of this age group, which was kind of adolescent or children, adolescent, teen demographic, and seeing what the exposures of those in utero cannabis use was. And it was linked to episodes of psychotic-like experiences. And so the use of psychotic-like experiences can be manifest and described as magical thinking. And not that people who 100% were exposed had episodes of magical thinking, but again, there could be associated risks with thinking, especially in the co-occurrence use of some substance use and or alcohol use, as we have seen in the previous slide, and the increased risk of increased occurrence of risky taking behaviors that may occur in this population. So the importance of the research that can be done within the American Indian population and through mechanisms like the Native American Research Centers for Health across the United States is a critical component to addressing some of those health disparities that we see every day. Thank you. This is a last slide, really looking at the road untaken. This is a area in the Tono O'odham area in one of our site visits, looking at a wash which deals with some of those issues regarding, because the Tono O'odham land traverses the Mexican-U.S. border, and this is a common site for people to come across the border with illegal drugs across native lands, which speaks to the topic we just addressed and Dr. Roubideaux's comment on sovereignty. Thank you very much. I appreciate your listening today.
Wonderful. Thank you so much for your presentation. It was very informative, very interesting. I do have a question for you. Do you mind going into a little more detail about the support provided to the AIAN high school aged children or students?
So there was a slight echo there. So that was only a small slice of the NARCH programs that exist there. And in addition to some of these other programs, the use of cultural components of the community and supporting and developing and allowing a mechanism for conveying some of those frustrations from a behavioral health side of it is something that we have ongoing, actually. And the pandemic actually put a kink in those activities, because what was basically an open mic. People would come, they would have poems, they would have songs, they would have stories, and open mic, and it just allows people to come speak in that teenage, high school area or demographic, and really convey some of those things that were really bothering them. And there's also been a variety of videos as well as short educational segments incorporating tribal members and addressing some of those issues of alcohol as well as substance use.
Wonderful, thank you. And again, if anyone else has any additional questions, please go ahead and make sure you send them my way and we will pass them along. I did want to take this time now to do another poll. So if you will please, I'm going to relaunch the poll, and if you could complete it, once again, we'll take another minute to do this. Hopefully you see that up on your screens. Great, wonderful. And we do appreciate you taking just a moment to complete this poll and our other polls throughout this webinar. Great, we'll give it about 15 more seconds. So if you haven't participated yet in the poll, go ahead and complete that and we'll wrap up here in just a few seconds. All right, thank you so much. And I'm going to pass it back to Lillian.
Okay, thank you very much, Dr. Calac. That was very informative, and now we know what California NARCH is all about. And I love this idea of your mentor being here, you're mentoring other people, students that you're working with. So we've got, 3 levels of mentoring going on here, and thanks a lot. Okay, moving right along. The last part of this program, we have a panel on traditional Indigenous medicine and research. We have 3 people coming from various backgrounds, and this is one area where I think we could, take up the whole day and talk about this, but unfortunately we have very little time. But we have 3 very well engaged, active, traditional practitioners and community leaders who are with us today. Babette Galang, I don't know if she's on right now. She was dealing with an emergency situation, but she's a traditional healing and complementary health director of Papa'olaka'i in Hawaii. She's Native Hawaiian. The PAPA is the Native Hawaiian Consortium established by a congressional act in 1988 to address the health statistics of the Kanaka-Maoli, who are the Hawaiian people. Babette advocates for support, preservation, perpetuation, and cultural integrity of traditional Native Hawaiian healing practices and practitioners. She oversees Kapuna councils, who are the elders of traditional practitioners, associated with 5 Native Hawaiian healthcare systems on the main island, on the major islands in Hawaii. She works with Kapunas, cultural practitioners, and has been taught by 3 traditional practitioners. She is very much involved in community activities, and she's immediate past chair of the American Indian Alaskan Native Hawaiian Caucus of the American Public Health Association. Next, we have Dr. John Molina, who is Yavapai Apache in Pasco Yaqui from Guadalupe, Arizona. John is one of those people who has all of these initials after his name, MD, JD, and I don't remember what else, but he doesn't have all of that listed here. He practiced as an OB, obstetrics gynecologist, for over 20 years and was health administrator of Phoenix Indian Medical Center, director of the Arizona Medicaid program. He's a Navy veteran, and he ran a Las Fuentes Health Clinic in Guadalupe, a small clinic where he was practitioner. He has many, many interests in culture and medicine, also healthcare and law, policy-related health disparities issues. And we're very honored to have him join us, take time out of his busy schedule as well. Mariddie Craig is a member of the White Mountain Apache tribe of Arizona. I call her my sister and my in-law, and she's also a wonderful, well experienced and person in all facets of White Mountain Apache life. She's been leader of many programs in her tribal community, including serving on the tribal council for 8 years. She established a radio station for her tribal nation. She also served as president of the National Indian Women's Health Resource. She has been very much involved with the NARCH program and having Johns Hopkins University as its partner. And she's been PI for many years, and I'm not sure if she's still doing that, but they've done some really good studies on suicide prevention, youth substance use, pneumococcal disease, empowerment to address health issues, and strengthening mother-daughter relationships. So these are 4 panelists. What we wanted to talk about was discuss traditional Native medicine in the context of research among Native communities. I know that, you know, a couple of the individuals said they don't do research, but just from your perspective as a practitioner, how do traditional medicine and research interface? If you think of the traditional medicine as one circle, research as another circle, how close do they come together? Is there an interface? And how do we, as researchers, how do we deal with issues of traditional medicine? And when we say that, we're defining it very broadly. When you ask people what is traditional medicine, you'll get a lot of just a broad spectrum of answers, such as that the daily practices that people go through to smudge, to pray, to use herbs. Some people say food is medicine, especially traditional medicine is considered traditional, or traditional foods are considered traditional medicine. Our sacred dance and songs, there are ceremonies, and some of the things that you've all been taught or have practiced. So starting, I don't know, is Babette on? Has she returned? No? So why don't we start with...
she's there.
Oh, she's here?
Yep.
Okay. So Babette, aloha. Mahalo for joining us. And would you like to start just talking about briefly what you do and how you see this world of research and traditional medicine and how they interface?
Yes, thank you, Lillian. Can you hear me?
Yes.
The garbage man was just here, so there was a lot of noise, but let me just say aloha and thank you all for inviting me to be part of this panelist. I'm very honored and humbled to be here with both Mariddie and John. And of course, Frank, thank you for that blessing. I'm not familiar with the issues and concerns of the American Indian, Alaska Native researchers. But I think in a sense, we all are researchers, you know, even those that are not focused on research. But what I'm going to share is my mana'o. This is my thoughts from experiences as a Native Hawaiian traditional practitioner in La'au, which is herbal medicine, in Ho'oponopono, which is tending to a broken relationship, and in Lomi Lomi, which is massage. And also being mentored by Hulu Kupuna precious elders whom I was most fortunate to meet and accepted in my lifetime. Most have passed, but I'm here to honor their wisdom and knowledge and share with you some of their messages. The question I developed from reading what Lillian sent me was, what does research or researchers need to do and know to successfully incorporate traditional medicine guidance for a more meaningful research outcome? And this is just a Native Hawaiian perspective. And I'm very impressed with what was shared earlier. Okay, first of all, for me, you need to develop a deep understanding of what traditional medicine is before you can begin to understand what it is, and more importantly, what it is not. It took years for our ancestors to reach answers and solutions we share today. And like in 10 minutes, you know, it's like a grain of sand on the beaches in Hawaii. Need to ask a few questions, and listen not only with your mind and your brain, but with your na'a, which is your gut, and sometimes your heart, for the seed to be planted, the beginnings of an answer. Ho'olohe pono. Listen properly. More questions will develop to help you with clarity, validation, and begin your journey to whatever connections or outcomes you seek in your research. Learn to hear what is not said. Take time to process and talk to your elders in your communities. Most cultural kupuna practitioner I know and or mentored with spoke with the least amount of words. And when they spoke, you did not interrupt them. When given the opportunity, your questions should be respectful, appropriate, humbly asked, and truthful. There should be no hidden agenda or challenges. And the outcomes of these many conversations should reflect the values of your culture and your people, their ancestral knowledge. It should contribute to the protection, preservation, and perpetuation of the values your elders and community reveres. So what you eventually learn will either contribute and confirm your theories with great confidence, or change what you initially intended to do, knowing that the question was not worded well. So, mahalo keakua, mahalo kupuna, mahalo elders. That's it, mahalo.
Thank you, Babette. Next, we'll go to Dr. John Molina.
Yes, hello, Diolson Chanyalo. Can you hear me?
Yes.
Ayusan Chanyalo, Nepo John Molina Teak, Manatebote Vekit Newi. Inepo Achai, John Molina, Senior, Pascoyaki, the Guadalupe, Inepo Maria Elena Ward, San Carlos Apache. Good afternoon, everybody, and thank you for inviting me for this interesting but very enlightening conversation, and I appreciate all the presenters, some great information that you bring out there, and thank you, Yvette, for the presentation you just did. I think you said quite a bit that I think helps us to direct us to think about how, if any, there is this sort of overlap between traditional Indian medicine and research. I look at research as being sort of Western ideology. I don't think our indigenous people are really worried about research. We observed the land, we accepted things, and we believed in things. It's the Western environment that has brought research into communities to try to understand things, to break things down. As a physician, I think research is good. It helps us understand the issues and approaches the issues. And in the Western way of looking at things, it could bring great value to humanity, much like the All of Us program. But what about traditional Indian medicine? My question is, why should we research it? And I think Babette made some really good, interesting observation as the importance around it, and the things that we can learn and maybe apply into a greater population among indigenous people. I am not a healer myself, but I have had the blessing to have a grandfather, San Carlos Apache, who was a medicine man and performed a lot of ceremonies in San Carlos. And then I had a grandmother, indigenous from Mexico, who lived in Guadalupe, and she performed a lot of healing ceremonies. And when I went to medical school, I had the opportunity and the privilege of living on Pascoyaki while I attended medical school for the first 2 years in basic sciences. And the opportunity to actually be mentored by a Yaqui Hetevi, a medicine man, Porfirio Yokiwa. And I think that really that sort of background helped me to look at the role of healing and traditional Indian medicine, what it means for our people. And for me, traditional Indian medicine is sacred. It's always been sacred. It's holistic. It's about mind, body, and spirit working together to enhance the life of our indigenous people, which has kept us resilient for thousands of years and continues to even to this day. Even though the tragic consequences of the boarding school, which assimilated a lot of our ancestors and brought in Christianity into the mix, we still have not lost the sense of spirituality in traditional Indian medicine. And I think that for me, research has to be very carefully looked at. And I think great comments by Babette, and I couldn't, support that much more than to say that when we approach research Indigenous communities, we need to look at it in more of Indigenous methodologies. This idea of respect for culture, respect for the ceremony, to understand and to listen, to create that sense of relationship, if you will, with a traditional healer, to understand the mechanism. Again, maybe we need to understand why we're asking the question. Why do we need to understand the question? What importance does it bring to our community and to our people? And I think the research has really helped us to understand different ways to heal from historical trauma, trauma-informed care, a lot of different methodologies that have been used on reservations to heal from historical trauma as a result of research that we've done in traditional Indian medicine. Again, but it's a very delicate balance that I think we have to approach it with. And I think we probably have to approach it even individually within different tribes. Some tribes are more assimilated than other tribes. If you go up to Lakota country, they're very traditional people. But then when you deal with tribes like Gila River, maybe not as traditional. There's different ways and different ideas about ceremonies. So you can't apply one research methodology to all tribes. It's got to be very tribal specific. To take time to get to know the community, to get to know the people, to get to know the ceremonies. And sometimes the researcher might have to change their approach or maybe change their thesis based on what they're learning about the community, because the research should not be just about the researcher. People do research today to gain recognition, credibility, and new information, but it shouldn't be about that. It's turned around the other way, I think, when we deal with Indigenous research. And I'll just kind of close with this little sort of experience that I had, not only with Porfirio Yokiwa and Toscoyaki, who taught me some of the principles of healing so that I could integrate it into medical practice in the Western way, and the importance of what he thought, what was traditional medicine and healing. For instance, one thing that I never learned in medical school or in residency that Porfirio Yokiwa taught me was the disease is trying to tell you something. Listen to it. Then when I was in Las Fuentes Health Clinic, which is the clinic I created, the free clinic in my community of Guadalupe, I worked with another medicine man, Indigenous from Mexico, Don Acosta. And one of the tenets that he taught me that he brought into his healing was that the first question he asked his patient as a healer was, do you want to get well? Do you want to get well? Very interesting in these takes that our medicine people take in the course of healing in traditional medicine, which are really principles based around the holistic idea of care, the mind, the body, the spirit, how we're living ourselves. So when we're going to do research, it's become very complicated because all these factors have to be looked at, the connection, these variables of mind, body, and spirit. And my last question in research is, what are we measuring? Is it something objective? Is it something subjective? Because the subjective part of it can be very complicated. The objective part, sure, we can do measurements of blood serum levels, of cortisol, epinephrine. We can do maybe a qualitative analysis with surveys. Very complicated. But I just say that in closing, that when approaching research in traditional Indian medicine, it's very tribal specific and could be even very person specific. So just some of the things, but again, Babette did a great job on framing that. So I just want to thank you. So thank you.
Thank you very much, John. Okay, so now we move to Mariddie.
Good morning. It's truly an honor to be here with you. And thank you to Lillian, my sister-in-law, and to all those who have done a wonderful presentation this morning. I want to begin by telling you about my personal knowledge of who I am, what I believe in, what is important to me. And of course, we start with each day I do as a mother of 3 sons, 9 grandchildren. I start my day with a prayer. And with a prayer, I have my traditional pollen, my yellow pollen. And with that, I also have my little medicine bag. And of course, my salt. Salt is very important for us. We have this at the Great Salt River Canyon on our reservation, and it helps me to take a little module and take it in and know that I'm going to be careful with my words throughout the whole day, that I won't abuse my words against others or against myself. So that is very important to me. And of course, we use the plumes, the feathers. In this case, my plumes, this particular plumes were used to do a cleansing ceremony for me. And then of course, my sage for burning. And we as Apaches believe that the smoke that rises and reaches our God, and it communicates with him for us as well. So that is very important for me to start the whole day. But my focus today with you is to bring to your attention the importance of the family structure and how we should provide their meals, provide food for them. It's so important. I have before me here 2 types of tus meaning water jugs in Apache. I have this big one and this small one here. And both are used for carrying water. And water, as you know, is a very essential element in our lives. It's so important that we have that to make sure that it cleanses our body and helps us with our words that we deliver. So each morning you start with your water as well as these prayers. So to me, important to me is having to make sure that I share my Apache knowledge with my children. And what is that about research that is important? Well, you know, research is really important to me. I know that there are people out there that may disagree, but it's very important if we're in a position to help our children, our generations to come to be here with us and to carry on our culture. We have to hang on to what we are, who we are, and to let them know that life that is sustained must be supported properly by research. We have to make sure that we do culturally sensitive research activities, and that's why we're involved. But to me, now is fall time, and so I have with me to share with you that I'm working on a trail mix for my children. I want them to know how important their traditional foods are. This is acorn. Acorn is very important to our livelihood. We go out to gather it, and when we go out to gather it, we take it and we clean it, and then we make sure we shell them and grind it down to a flour. And this flour itself we use in our soups. Our soup that we have would contain cubes of meat, and perhaps we add dumplings to it and squash, and it's really wonderful. And then of course, because earlier I mentioned that trail mix is very important, I'm also working on parched corn so that I can mix this with my shell acorn and provide that to my children. This is something I grew up on as a young child. It's something that was very endearing. At the time, I think I took it for granted, but I think it's really important. And of course, gathering for piñons too. Now is a good time. Piñons, Yvette, this is called Yvette. We go out to gather, pick them, come home, and we clean it as well. We clean it very well, wash them, and then we parch it. You can do it in a frying pan, or you can also put it in the oven. But you got to watch it to make sure you don't burn it. And then, of course, in my water jug here, I have is traditional tea. Tea is very important. It's medicine in itself. And growing up, that was boiled for us when we had it for breakfast. Little did I know that that was medicine. Today, I know how important it is. We take it and fold it down into a bundle like this, and we keep it for the winter months to come. Or whenever somebody is sick, that's when we do the tea for them. Just a few days ago, I was not feeling well. And so my granddaughter who was with me, she ran into Starbucks and she brought back some wonderful tea. And boy, did that settle my stomach. So this is the same with the traditional teas. I think it's really important to know and understand how important research is, because these are things that we want to know more about. What is it for? Where did it come from? What can we do about it to preserve it for our people? We don't want it restricted from our use, but we want to make sure that it's there for us. And we're asked, okay, what is the role of traditional medicine in research? In my opinion, summarily, traditional medicine to all Indigenous people will vary, but it should all be preserved and protected as their traditional medicine is sacred. Okay, is there a place for traditional medicine in research? Yes, there is, as long as, like I said earlier, it doesn't restrict our use of medicinal medicine. In terms of traditional medicine, is it considered taboo for inclusion in research? Our tribal practitioners have always taught that our lifeways are sacred and everything that we have are to be kept within our boundaries. Sharing outside of the boundary is taboo, but we're in a different environment today. I'm not trying to separate the two, but it should be a blended world where we can say, yes, we can depend on research to help us understand what we have to help us preserve our culture, preserve what we have, our foods, our lifestyle, our ways. So we need to depend on research to help us to bring answers to what we have. And then we're asked, what else can we do in terms of research? What advice would I have to the traditional medicine to offer change to this type of research? Well, let me tell you a short story. You know, as I'm thinking about the audience that might be out there, there will be some really brilliant minds of Indigenous people listening. And then there will be others, professors who will be listening. I would say to them, it's very important to understand that we as Indigenous people all come from different various backgrounds. I grew up being taught about everything being sacred. I really didn't know as a little child, but such that we were not to talk about or share that information, and because they were basically sacred. Well, I grew up with the Apache language being my primary language, and that itself is sacred. So some of these brilliant minds that are out there, they're wonderful, but they can't speak the Apache, the native language from their hometown. And so now is the time to be learning about this as much as you can and help us in return, while I as an elderly can say to you, as a child growing up, my language, my Apache language was such that I felt like I couldn't understand English very well. I couldn't speak it. I still don't speak English very well, but I really did feel like I was looked down on growing up because I couldn't speak English. But today I look back and I'm okay with it. But I think that it's important because as intimidating as it felt, I did feel like I was considered dumb. But in reality, I had a strong upbringing. That strong upbringing had a solid spiritual belief in our Apache way, a life way that Western society knew nothing about. So in research, scientists out there, scholars know that every man that walks on this land has a purpose, and that purpose needs to be respected. Thank you very much.
Thank you very much, Mariddie. I need to say that, you know, we call each other sisters and in-laws, but in the Indian sense, I guess that's our relationship. The Navajo and the Apaches were one people, and somehow we all separated. The Apaches went one way, and we called them mountain people, Diné. And so in that sense, we're Indian sisters. And then when we say in-laws, I know that Mariddie was married to a very well-known entertainer and storyteller. So she was married to a Navajo person. So she's our in-law in that sense. So anyway, but thanks so much for sharing that. I'm looking at the things you have, and a lot of it, our people, Diné, you know, still use that, like the water baskets, maybe not to the extent that you're all using it. I've seen it. I've seen it in some ceremonies where people bring water in. And like you said, water is very sacred, so it's used in ceremonies. Corn pollen, people use that every day to meet the sun, a new day, new opportunities, and use that for prayer. And then the medicine bag, most people I think are familiar with that, and we carry that, put corn pollen and various things in there. And when we go to unfamiliar situations like hospitals, we take those things, you know, to protect us and to connect us to where we've come from. Parchment corn, I remember a lot of that being cooked on stone tablets when I was growing up, and we certainly used it when we went on trips. And you know, these are all sacred things because today, not very many people are using that. Not very many people are taking small amounts of food, you know, when they travel. Instead, we're stopping at McDonald's and Whataburgers or whatever those places are. Tea is very important. There are lots of different teas. Teas for many purposes, teas used for medicinal purposes, and even in the grocery stores now. You know, you go in and you find boxes of teas for sleep, for relaxation, for colds, for as probiotics, and, you know, things like that. So I think we're surrounded by traditional medicine and traditional medicine practices. And I thank you all for sharing your knowledge and your perspectives on these things. And I don't know if we have any questions, Maggie?
Yes, just one question for anyone in the panel or all of our panelists. The concept of historical trauma is becoming more of an understood mainstream concept. How might traditional medicine be used in research related to historical trauma in the Native community? And I would say feel free, anyone can jump in and answer.
Hello, this is John. I'll just give my perspective of my tribe. Again, all Indigenous tribes experiences unfortunate circumstances historically, you know, between the wars and massacres, land relocations and boarding schools, which has been passed on from generation to generation through a lot of different mechanisms, both biological and also socially. And what we find is that in healing from historical trauma is critically important because I believe that a lot of what our people still maintain, you know, in that spirit in their lives really affects their lifestyle. You know, the major cause of morbidity and mortality among Indigenous people are chronic diseases. These are preventable diseases based on lifestyle choices. So I think our people still suffer from this sense of oppression, depression, anxiety, and stress, not only living within the reservations, which are so impoverished, but also in urban areas where they're having to live in two worlds and two different cultures. So what I find would be interesting is that what are some of the ceremonial things, from very basic smudging to maybe inipis, to maybe doing more ceremonial specific tribal rituals that will help a person become more of themselves again, to achieve that sense of wellness, not only in the physical sense, but spiritually and emotionally. Because again, as I said earlier, our people are spiritual people, and we can't take out that element from the whole process of healing. So ceremonies have been designed since time beginning to help heal our people, both mind, body, and spirit. So looking at different ways that we use ceremonies to help our people live a more healthy lifestyle, to make better choices, to be more stress-free, to help deal with bicultural world. I think especially for our urban population, which holds a lot of our Indian people, having to live in a world that is very still discriminatory, bicultural, you know, a distrust of institutions. I think looking at ceremonies that will help us connect us back to our spirit would be a great topic of research.
Thank you, John. Anyone else? Babette? Mariddie?
I agree with Dr. Molina, and I think we all try to, healing a person physically, my understanding from my teachers, is easy. Healing a person spiritually and emotionally, that's where you have the problems. And so you really need to find out what the source of the problem is with specific people and try to address that. I don't know if you can be successful in this lifetime, but I think taking one thing at a time and dealing with that the best that you can, going into meditation, going into pule, going into prayers. It's a very, very difficult problem and concern, even for Native Hawaiians who didn't experience genocide as American Indians and Alaska Natives have. But we have cultural trauma, which is also, you know, trauma. And so it's a very difficult subject. And I think as Native Hawaiian practitioners, we just try to do our best to address the spiritual part of our people. Thank you.
I would like to say something real briefly. I know that it's, can they hear me?
Yeah.
Okay,
Yes.
I know that it's really important to understand that what I have presented today requires a process. Our water jugs, the tus, the gathering of the tea, the gathering of our corn, cleaning it and parching, our pinon gathering, acorn gathering, the grinding process, and the bundling of the tea. And of course, our sacred objects that we have, we must travel distances to make sure that we collect all of these, and it comes to this point. And that started long, long ago, and we're still carrying it on today. And so historically, it's something that is healing for us. We bring our family together. We reinforce the importance of hanging on to what is very important to our children, our generations to come. And so the healing aspect of it is ongoing, and I appreciate the fact that there are so many people out in the world, our Indigenous people are retaining that importance process of survival. Gone through a lot. We have gone through a lot, but we continue to be strong, and we go forward. Thank you.
Wonderful. Thank you all. We do have one more question for our panel. What protections can we put into place to make sure research isn't used in a way to say there is no evidence for our traditional practices? And again, I would direct that to whoever would like to start first.
I would like to just generally say that under our NARCH program, we protect all our research information, and it's basically run by us, the White Mountain Apaches. We have a command of what is going to be researched and who's going to go and collect this information, who's going to get it, and the tribal council receive this data and no one else. It's preserved and protected. So if somebody wants to get this information from the tribe, they have to go before the tribal council. It cannot be shared so easily. And so that's the way we should continue to be with all of our information out there. Thank you.
Yeah, I totally agree with that. I think our tribal councils have done a good job to try to maintain the integrity of our culture because we know it's sacred. And I know in some tribal communities, they do have committees or people that respond to these sort of requests from researchers that they can look at the research, what it's all about. The issue with me is that what about the urban populations? For researchers who try to go into urban areas and do research on traditional Indian medicine, there's really not that oversight. And this is an issue that we're kind of trying to deal with in urban areas like in Phoenix, where we have probably in just Maricopa County alone and in the Phoenix area, 250,000 Native Americans live here in Phoenix from 300 different tribes. So my question is, who oversees that? You know, the researchers pretty much have free game to go and to survey Native American families with not that oversight with regard to the integrity of the research, the questions that they're asking, what's going to happen with the data, who's going to get the data. So I think that's one of the challenges that we're going to find with our people, because again, like I said, over 60% of our Native people, our relatives, live in urban areas now, where there's not that kind of protection. So this is one of the areas that I think that we need to look at going forward.
I'd like to make a comment on protecting our traditional medicine through where research is going to take place. For the Navajo Nation, we have a institutional review board. So anybody that wants to do research on culture, language, medicine, you know, whatever, they have to present their proposal to that institutional review board. And they have practitioners there, they have Native scientists there, and so many of those are like ill-conceived. Like, for example, there was one researcher that wanted to take a prayer in our practice and use it to make a false one, a false prayer, kind of like make a placebo prayer and see what effects it has. You know, the real prayer versus the placebo prayer. This is what this researcher developed in his mind. And so the medicine men, you know, they said, well, that's not going to work. A patient who believes in that placebo will also get well. even if the real prayer is also done. So it depends on how the person believes in the prayer. So that's, so if you have your own tribal institutional review board, that's the way to put some protections for it.
Yeah, thank you, Frank. I know that Frank serves on the IRB through Diné College. I want to mention that one of the things that the Native Research Network does is we have over the past since our formation provided IRB training, and that's something that we can certainly do, work with Indian organizations, Native organizations, tribes, so forth. And yeah, we do need protections, and some universities actually are starting to look at that in their IRB process. So like, for instance, my university has put everything, when we're doing Navajo studies, they want us to make sure that everything is in the Navajo language, although they don't know that a lot of people don't know how to read the Diné language. And so that makes it a problem. They don't understand that. So things like that, we can do, some training and enlightenment of people. There was one other question that Dr. Roubideaux posed, which was about the application of Western scientific framework to traditional medicine, because we're coming from two different worlds, it seems like. One example might be how researchers tend to apply something like the health belief model to issues or questions that they're looking at in our communities, and sometimes some of those frameworks have not been used or tested in other populations besides the general US population, things like that. And then just the whole orientation of Indigenous traditional medicine is very different. Just like I mentioned earlier, Frank was saying, if you speak your language, you are thinking about things differently. When you speak that language, your world view is different than when you speak the English language, or when you're mixing English and the Diné language, which a lot of young people tend to do because they cannot really carry out a full sentence, and so they toss in Diné words here and there, and it's hard to understand and follow their logic when that happens. So anyway, that's something I think we can think of, and perhaps in 2021 we could ask some of these questions and share with one another where we go with these kinds of things, these kinds of questions. Okay, so I think we've come to the end of our time. Do send us questions that you weren't able to ask, and any comments that you have. And thank you very much for joining us.
Lillian, real quick, before we sign off, I wanted to do
Yes,
one more poll.
I'm over to you. Yes, for evaluation.
One more evaluation. So same thing as our previous ones, just go ahead and complete this. It'll just take another minute, and then I'll send it back over to Lillian for just the last moments of our webinar. Wonderful, and we'll give it about another 30 more seconds here. So if you haven't quite gotten to the evaluation yet, go ahead and complete that. All right, just another second here. I think we still have a few more All right, and that's it.
Okay, well, thank you very much for another successful webinar. Next week's webinar will be on November 18th, 2 to 4 o'clock Eastern Time. And I say thank you, ahehe, mahalo, palamie. Thank you very much for joining us.